Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. There are no new cases of COVID-19 to report. The total number of cases remains at 290. As of this morning, one individual is hospitalized and there are no patients in ICU with COVID-19. As of this morning, 257 individuals are listed as recovered and there are 26 active cases. Yesterday, 379 lab tests were performed, taking our total to 35,578. We have additional information to share on the one new case we reported over the long weekend. This was an individual who was at work at the Walmart in Southdale last Saturday. The individual is working on the floor. It's unlikely there had been contact with customers. But we wanted to ensure people were aware of this. Individual was working at the Southdale Walmart from 4 to 9 p.m. on Saturday, May 9th. So again, this virus is not airborne. It's spread by close, prolonged contact, and there is a minimal risk in this situation. But I want anyone to be sure if they were symptomatic at this time and were in that area to be sure that they get tested. And again, this is a reminder of the importance as we move to reopen things that we have to ensure we are not out in public when we're ill. That we are practicing social distancing, but employers as well as the public need to ensure that we don't have people who are ill out in public to reduce the chance of exposure. So again, low risk in this situation, and only concern is that specific time, but we wanted people to be aware of that. Again, I encourage all Manitobans with symptoms of COVID-19, fever, cough, runny nose, sore throat, shortness of breath, headache, to get tested for COVID-19. We certainly have increased our testing capacity, and any symptomatic Manitoban is eligible for testing. So we're continuing to move forward with our reopening plans. Our numbers have continued to look favorable, but we continue to remind everyone that this is not a return to normal. We still need to be very strict with our physical distancing when out in public. We need to ensure that we are not going out while we're ill. It's very, very vital to our success moving forward that people don't attend work or school or out in the public when they're ill. Today is World Family Doctor Day. So this is an important day to salute our family physicians. And it's also an important reminder that people need to keep up with their health care. There is more to health than this virus. We certainly want people to ensure they're keeping up with their health care needs. So contact your physician. It's safe to attend our healthcare facilities. You can certainly call ahead. A lot of these visits can be done virtually now, but do take the advice of your physicians. See your physician as necessary, and please keep up to date with your healthcare needs. And Manitobans are well aware of all of our steps moving forward to practice social distancing at all times, hand washing frequently, disinfecting frequently used surfaces, and again, very vital, staying home when you're ill. We continue to recommend reducing non-essential travel. As our numbers remain favorable, we know that that's not the case in many jurisdictions. We need to reduce the chances of importation of this virus into Manitoba. So people entering Manitoba from outside the province, you're required to self-isolate for 14 days. Those that are at significant risk of severe outcomes, those over age 65, those with underlying medical conditions, especially cardiac, respiratory conditions, those with immune compromise. Again, we're advising a more cautious approach that should continue to limit your contact with others, certainly physical distancing at all times, but really only going out for essential reasons at this point. Businesses that have questions about how the orders apply to them can visit engagemb.ca. And Manitobans should continue to access our website, manitoba.ca/COVID-19 for up-to-date information. So once again, thank you, and I'll pass this over to Lanette.
Thank you very much. Good afternoon, everyone. I would like to start by joining Dr. Roussin in thanking the family doctors across the province for all that they do to better the health of our patients throughout Manitoba. The family physicians are the first point of contact for many patients, and they play an incredibly important role in preventing illness as well as managing disease. And throughout this pandemic, they have joined other healthcare providers on the front line of this battle to continue caring for their patients and also volunteering in other roles. So we want to thank them on Family Doctors Day for their dedication and their professionalism and their contributions in keeping patients safe. I also want to announce that the Thunderbird House is a new community testing site that has now opened in Winnipeg. The site was established to better serve Winnipeg's downtown population, including those who experience homelessness or who live in shelters. The site is open 7 days a week from 9 a.m. to 5 p.m. And again, we want to thank our community partners for their assistance in getting this site up and running. And that includes the Aboriginal Health and Wellness Clinic, the Manitoba Métis Federation, and End Homeless Winnipeg. So this is now the 5th community testing site in Winnipeg and the 17th location within Manitoba. For a full list of locations and hours of operations, you can go to manitoba.ca/COVID-19. And with that, we can open the line to questions.
Thank you. A reminder to our reporters online, you'll have one opening question and one follow-up question. Up first this afternoon from CBC Manitoba, Aidan.
Hi, Aidan Green from CBC News. My question for Dr. Roussin, regarding the Winnipeg case that you touched on earlier, what is the transmission chain for that person? Is it known if is it believed to be community spread or travel-related or linked to any known cases?
Yeah, that's right. So on this one, we haven't been able to link it to travel or to a known case at this point. So we would consider it right now as a community transmission.
Okay, and also on that case, can you tell us more about the contact investigation going on right now? Are any other employees of the store or close contacts being tested right now?
Yeah, so there was a number of contacts that we were aware of that we could identify, and so they would be certainly self-isolating and offered tests. And then just because of the nature of the exposures at that time, we felt it needed to be announced just for other people to be aware, although we do find it's likely a low risk that many other people were exposed.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin, you mentioned a couple of times that you believe there's a low risk of transmission from this worker at the retail store who's working on the floor. Can you explain why it's a low risk? I know the transmission depends on close, prolonged contact, but this was an indoor area where there are large numbers of the public.
Right, yeah, and it's exactly what you said, is that with physical distancing, right, one of the hallmark ways of preventing the transmission of this virus, it makes it low risk. So during the contact investigation and the review with the client, there wasn't opportunities that there was close, prolonged contact with any customers. So it makes it low risk, certainly not zero risk, and that's why we announced it.
Okay, and we haven't seen you in a few days, so I thought I'd ask you again a question you've been asked repeatedly. As the number of active cases continues to drop, are you looking at further loosening of restrictions? Does this speed up that process? As long as interprovincial travel is still very limited, Are you confident you'll be able to loosen the restrictions if these numbers continue this way?
Yes, yeah, it's something that we continue to look at, and I think that we probably will be ahead of schedule in some of our loosening. I don't have details on that today, but it's very likely that we're going to be ahead of schedule on some of the loosening of the restrictions that we had planned.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwin from CTV Winnipeg. I'm wondering why are we just hearing about this case at the Walmart now if they were working on May 9th? Can you tell us about when that person was tested, when the positive results came back?
Yeah, so the individual, I believe, was tested on May 14th. And then so we had about the turnaround. That's why we got the result over the long weekend.
Okay, thank you. I'm just wondering about enforcement. You said at the beginning of the reopening plan that enforcement would be important. But we've only seen, from the city's only really given out 4 tickets. The RCMP gave out 8 tickets to people going to northern Manitoba. Does enforcement need to be stepped up, or can you talk about how that's been playing a role?
I think just in general, but we also seen during this entire pandemic, is that most Manitobans follow the advice, and so almost all Manitobans follow the advice. Some require a bit of education or reminder about it, or assistance on how they can comply, and then it's just the rare ones that. Persistently not follow the orders, and then those are the ones that would get, say, sort of the tickets or the fines. So I think for the most part, our numbers have shown that Manitobans have been following our advice, but when necessary, we will use the ability to offer fines.
From City News, Jonas.
Good afternoon, Dr. Roussin and Lanette. Lanette, a couple of questions for you this morning, coming off a conversation with Darlene Jackson from the Manitoba Nurses Union. One question that she'd raised is regarding the CBA for Manitoba nurses. She says that it's been 3 years since they've had an agreement bargain, haven't seen a wage increase in 4 years. I guess as COVID progresses, is there any movement on this or a timeline to discuss this?
Yeah, that's a good question. There still is conversations going with our human resource, our labor relations, and government. So it's really up to them in terms of how quickly they want to progress and where they're at in those negotiations, or when they want to get moving on them. So it's still on the table, absolutely, and it will be. I appreciate what they're saying. It does need to. We do need to start making some decisions on it. There's just some things that have to be put in place before then.
And a quick follow-up too, coming out of that. One thing that they had mentioned is when we went through SARS, H1N1 recommendations moving forward, the stockpiles of PPE. One question they want to know is why didn't the province have PPE volume covered heading into this? Is this just something that needs to be looked at again? Your thoughts on, ensuring PPE stockpiles going forward?
Well, we were actually looking at PPE stockpiles before COVID-19 came to Manitoba. We were doing that as part of our provincial planning effort. We were looking at making sure all the staff were fit tested for N95. We had done an inventory of the stock in the warehouse. So that was all done. When COVID-19 came, we actually were in, we thought, a good position. We had more on order. What happened was that there was a global PPE situation that happened, and so we had to adapt our plan, and we've also been updating our guidelines for PPE as we go, and as evidence is emerging about COVID-19 and looking at what other jurisdictions are doing and what those outcomes are. So I would say we were prepared. We probably weren't prepared for a PPE shortage globally, but I think we've adapted and found a lot of different solutions But it's still an ongoing challenge, and I suspect it will be as long as we have COVID-19 circulating around the globe. That it's something that we always are going to pay attention to and monitor and track, and we'll want to use that PPE appropriately and make sure our staff are safe, but also that we're able to provide services for patients.
From the Winnipeg Free Press, Carol.
Good afternoon, it's Carol Sanders at the Free Press. Dr. Roussin, there hasn't been a positive case of COVID-19 reported in the north for almost 2 months. Why aren't you lifting restrictions for the area north of the 53rd parallel so businesses up there can reopen?
Yeah, well, I mean, I think that's that was the goal, is to not have cases up north. Certainly, we know the remote isolated communities are quite susceptible to outbreaks and severe outcomes should the virus get there, and so that's the reason why the restriction is there in the first place. And so we're always looking at our interventions. We're always looking at that balance between the economy and protecting the health of Manitobans, especially those that are susceptible to the severe outcomes. And so we're continuing to look at that.
And can you just explain why you're okay with Manitoba Hydro's plan to bring 1,000 new workers, including people from outside Manitoba and Canada, to Kiev, the construction site, and you don't think it's safe yet for Manitobans to travel north of the 53rd?
Yeah, it's the plan that's in place, right? So those people being brought in from other jurisdictions are required to self-isolate for 14 days and receive a negative test before they go up there. So certainly that is fitting with the public health guidance, and so that's what reduces that risk in our opinion.
From Global, Brittany.
Good afternoon, Brittany from Global. Dr. Roussin, as more and more large businesses start to reopen, like New Flyer and IKEA, how does that process work? Do they have to submit or resubmit a business plan to your department of the province to sign off on? Can you give us a little bit more details on how that process works?
Yeah, it's not really business by business. We have sector-based guidance that we'll be working on to provide the approach that businesses can take to limit the transmission within their facilities. So it'll be up to the business to ensure that they are implementing guidelines so it's safe for their employees and they're minimizing the risk. So it's the same sort of factors. It's the screening of employees, it's the physical distancing, the ability to hand wash, and all of these measures. So again, it's in these facilities or anywhere for that matter, it's going to be vital that both employees and employers are screening people for symptoms. We can't have people showing up to work ill. And that's the only way we're going to be successful moving forward. It is a new normal, right? I think that it's not about blame at all. Like how many of us have shown up before to work or gone out with a cold, but this is the new normal. We can't have that anymore. And so moving forward, that's really the vital key to our success.
Thank you. And seeing as we've only had one new case in 7 days, you said that might mean that we can move forward more quickly on the easing of restrictions. What might that look like, and how soon might we start seeing some of those restrictions eased?
Yeah, so I don't have details I'm going to share today on that, but we know June 1 was our target date. It's likely that we'll be able to have some measures before then. And so probably going to have more details for you later this week.
From the Brandon Sun, Bud.
Yes, Bud Robertson at the Brandon Sun. Dr. Roussin, just coming off this long Victoria Day weekend, which was lovely and beautiful all out there, when do you think you would expect to see any effect of the long weekend on the numbers?
Yeah, so we're looking at probably an estimate as at least one incubation period. So a couple of weeks after that is where we'll typically see. So we know most people who are exposed to this virus will start showing symptoms within 7 to 10 days, sometimes up to 14. And that's that's when we'll see the effect. Certainly by 2 incubation periods, then you're sure to have seen an effect by that time.
Okay. And on a follow-up question, same for you, Dr. Roussin. I'm probably going to say this wrong. I'm looking at my laptop. Hydroxychloroquine. One unnamed U.S. president has said he is now taking that daily. I just want to get your thoughts or advice for people who are looking at that and saying, maybe that's a good idea for me too.
So no, the only reason for using that for the treatment or prevention of COVID-19 would be as part of a clinical trial, because there isn't evidence that it's effective in preventing or treating COVID-19. So certainly as part of a clinical trial, that makes sense. But otherwise, I strongly recommend anyone prescribing it to someone for that purpose, or somebody wanting to be on it for that purpose.
From CJOB, Diana.
Good afternoon, Dr. Roussin. Diana here from 680 CJOB. Earlier, the Premier said gathering sizes might increase mid-May if all goes well as far as numbers. We're mid-May right now, and I'm just wondering when that might happen and by how much the group sizes might be able to increase to. Is that going to be a group gathering maximum of 25 people? And is this something that, again, will happen before June 1st sort of thing?
Yeah, and that's the thing that we're one of the things that we're looking at, and I do expect that certainly to be ahead of schedule from June 1st. Don't have the details on that today, but later this week I will.
Okay, and then just as a follow-up with respect to other things we might see loosened in terms of restrictions, the list of services and businesses included in Phase 2 is pretty limited compared to what we saw in Phase 1. That was very detailed, a long list of things that were allowed to begin operating. Do you anticipate some changes to what we might see in Phase 2 versus what's kind of on the website and expected right now? Obviously, expansion of public gatherings, restaurants, dine-in services restored, film production, non-contact children's sports. Will we be seeing more than that happening in Phase 2?
Yeah, so we've come up with a pretty good plan. It's not quite finalized yet, but hoping later this week to be able to share the details of that Phase 2 plan.
From the Winnipeg Sun, Glenn.
Yes, Dr. Roussin, Glenn Dawkins from the Winnipeg Sun. Would the federal border ban extension that I guess was announced today still allow for professional athletes to return to Canada under the worker provision? And if so, are they going to be subject to the same 14-day self-isolation period when they get here?
Yeah, so the international travel restrictions and orders fall under the federal jurisdiction, so I don't have the details on that. Certainly, we're looking at how we could implement something like that regarding the pro athletes if they were returning here. So, coming internationally or across the borders, we'd have to have some sort of restrictions on the similar to a self-isolation. So, something that we're looking at. I can't speak specifically to the federal orders on it, but like I said, our numbers in Manitoba have been favorable, and so we need to be very careful about the importation of the virus. So anyone coming into Manitoba from outside, we're going to be subject to some sort of restriction to ensure we protect the health of Manitobans.
So it would be under the whatever the federal restrictions would be. So it wouldn't be a provincial restriction, or are there provincial restrictions that cut in as well?
Yeah, if so certainly the international travel, the Quarantine Act is written federally. That's a federal order. The interprovincial travel is ours. That's under our Public Health Act.
From CBC Radio Canada, Mohammed.
Hello, Dr. Roussin. It's Mohammed from CBC Radio Canada. I just have a quick question about the new case announced yesterday. Do we have any clue on where the transmission was? If there was at work or outside the work?
Yeah, so far in the investigation, we haven't been able to link it to a known case, and haven't been able to link it to say something as travel. So with these things, we get the contact investigation done quite quickly. And we still usually reach back and forth with the client to see if there's any more information on where it could have come from. But at this point, we're not able to link it to travel or to a known case.
Thank you. And I was wondering too, can people who are waiting for test results, should they show at work, like I think this case?
Yeah, it's a good question. So so for the most part, we're only testing symptomatic people, right? People with symptoms. And so our advice is really clear: is that if you have respiratory symptoms, with or without a COVID test, you shouldn't be showing up. You shouldn't be at work. You shouldn't be out in public if you have symptoms. So that's really the advice. Ideally, self-isolating for 14 days is the best approach. But certainly, people who have respiratory symptoms, whether or not you're waiting for a test result, you shouldn't be out in public.
We have a few moments left on today's call. If the reporters have any other follow-up questions to their follow-up question, please proceed.
Hi, Dr. Roussin. Hi, Carol at the Free Press. I just wanted to ask you about up north and people up there being in remote communities are susceptible to outbreaks. But until there's a vaccine, won't that always be the case? Will this be a situation where north of the 53rd can't open up until there's a vaccine?
Well, it depends. I mean, I think that we are going to be likely dealing with this virus for quite some time. There's lots we're still learning about the virus, but at this point, where we are relatively early on in the pandemic, we have to do what we can to protect those that are vulnerable and those that are susceptible to severe outcomes like outbreaks. And so we'll have to just come up with ways to deal with this virus going forward. But right now, as we gradually reopen things, we have to pay extra attention to make sure we're not introducing this virus into places that are very susceptible to large outbreaks.
So you could open it north of the 53rd, but not for remote isolated communities north of the 53rd? I'm just wondering if that's...
Yeah, I mean, it's we're always looking at ways to balance these things, right? And so certainly there's travel within the north. So even if you limit the travel just to isolated communities, there's some travel in and out of those communities. So it is a balance, but we are looking at ways to ensure we're allowing for economic activity to occur, but in a safe way.
Dr. Roussin, I asked KBC when we expanded testing, you said we may see increased numbers of positive cases. Obviously, as more people are tested, you're casting the net a bit wider. We're seeing quite low numbers, obviously just one positive case in the last week. Are you surprised by that? Obviously, testing has gone up significantly as well. What is your reaction to the situation we're in now?
Well, I think it's nice to see that, certainly, because we know that often when you increase testing, you're going to find more cases, and that's why, as part of our restart strategy, we don't really look, say, just at total number of cases. We look at positive test proportion, the percentage of positive tests, and that right now in the last 7 days has been 0.03%. So dramatically low. I think in Canada overall, it's close to 6 or 7% overall that positive test rate. So. I think it looks favorable for us. I think it looks favorable that we can continue with our reopen strategies, but we know we have this case. We can't link this case to anything in particular. So we know the virus is still here. So it's not that return to normal. We could see that upward trend again if we let up on our precautions.
Dr. Roussin, Brittany from Global, you've said in the past that you were only going to release details on cases if there was a risk, but then today you said there wasn't a risk with this Walmart employee. Maybe could you give us a few more details as to why this particular case you are releasing some details?
Yeah, I said that it was a low risk, not that there was zero risk. And so in most of our cases, investigations, we're able to identify all the contacts and reach them and have them self-isolated. In this situation here, we have that 4-hour period in a indoor place with multiple people coming in and out. So it'd be really difficult to say that we were able to reach all of the contacts, and so that's why. So we say it's low risk because, as per the advice, this individual had been practicing physical distancing, and so that makes it less of a risk. But we felt that this would be something that the public should be aware of.
Glenn Dawkins from the Winnipeg Sun, sort of follow up on that. If you were a customer at that Walmart during that 4-hour period, what should you be concerned, or if you have concerns, what should you do?
Yeah, so I mean, I think that this is, like I say, a low risk period. It's really important to understand that it's only during that time that you need to be at all concerned. It's not the day after. It's not today. There's nothing now that there's a concern of in that location. But if you're in that time, I would be extra vigilant about your symptoms. If you showed respiratory symptoms, I would ensure that you stay home. Of course, that's a messaging for anyone. And then certainly get tested for COVID. That would be the advice of public health.
Hi, Aiden from CBC. I'm wondering about the case in the healthcare worker in the Prairie Mountain Health region that Ms. Siragusa announced on Friday. I think had been found in the past 7 days prior to that. Is there a transmission chain that has been identified for that case, or is it believed to be a pop-up case?
Right. Yeah. So that one, that case was something we would consider of a community-based transmission. We weren't able to link that to another case or to travel.
Well, thank you. That concludes today's media briefing.
Thank you.
Thank you.